We get a lot of questions about brain health, Alzheimer's, dementia. People want to know more. If you want to learn about what you can do, stay tuned. Thank you so much to both of you for being here with us today. You have such powerful, powerful stories to share about brain health and dementia and brain support and family support, which is so critical as well. So we've only got a short period of time together, and I just want to get as much information out to people as possible. But hello to both of you. Thank you for being with us. Let's talk as we get into some of the how to navigate through dementia, brain health, and how to find support. Talk with us, and Jim, you could start if you would, please. A little bit about your journey. I should call it Dr. Mangi, but a little bit about your journey with brain health and what you've been through.
Sure, and I'm so happy to be here. The journey began about 15 years ago when my wife threw me out of the house. I had suggested to her that perhaps we should consult a doctor about her memory loss. And she immediately jumped to the conclusion, and she told me, "You're accusing me of being senile. Get out." So aside from spending the night in the hotel, I also determined that I needed to learn about what was going on and try to overcome this terrible, terrible stigma about this term that we seldom use anymore, senility. My wife was concerned that this thing that we now call dementia was somehow shameful and that I was accusing her of something. To this day, after 15 years of now taking care of my wife, I've never convinced her otherwise that what we're talking about here, Alzheimer's or any of the other dementia diseases, are just that. They're diseases. It's not a disgrace. So I have learned a lot in the 15 years of taking care of my wife. And in fact, by circumstances beyond my control, I am talking to you today from my wife's room at the Memory Care Center. So that tells you a good deal of where we've been through this 15-year journey. She is now living here in a memory care facility in Southeast Michigan.
You live close, very close to her as well, right?
Yes, indeed. We are fortunate to have been able to locate to a continuing care retirement community, which allows people to have whatever level of care they require. And in our circumstance, I live independently in a condominium on this campus, and this memory facility is about 1,200 feet away. So I'm able to be with my wife very, very often, and that is a blessing for which I am grateful.
That's wonderful. So you've got a personal journey with that. Dr. Cherie Robinson Lane, your connection with dementia and brain health has been a little different. Why don't you share with us, if you would, please?
It has been. For me, I have been a nurse for about the last 20 years and working in long-term care, particularly, and working with families that were looking to find resources to care for their loved ones in the community. And so I am doing research at this point to really understand how to better prepare families to age in place with disability, and particularly Alzheimer's disease. Like many of us, there's also a personal connection, and that my maternal grandmother lived with Alzheimer's disease from the time she was diagnosed, probably around 96 or so, but we were able to keep her at home for a number of years up until then. Until she also lived out her remaining years in an assisted living facility. And similarly, also with my paternal grandmother, who had Parkinson's type dementia, who we also were able to keep her at home for a number of years with the assistance of some home care until she too needed more care within an extended care community. So
You know,
it's both a professional and a personal journey, you know.
What has some of the research shown you? What have you learned?
Well, some of the things that we know is that while there are some hereditary factors that can play a role in developing various types of dementia, one of the larger factors that can play a role really is our lifestyle. And so, some of the things that we can do to make a difference to perhaps delay or decrease prevent perhaps the onset of cognitive decline is really taking good care of our health. And intuitively, I think most of us know that the things that we need to do to be healthy is to eat less and move more. And so if we can really stick with that, all of the other stuff kind of is, some extra icing on the cake, so to speak.
That's powerful. And something that you both alluded to was the stigma that's
Mhm.
attached to, when I was young, they used to call it she's slipping.
Yeah.
That aunt so and so or grandmother is just slipping, which means that
Hmm.
she's kind of not doesn't have her full cognitive memory and all of that. But the stigma is something that AARP really tries hard to diffuse because, like you said, Jim, it is a disease. And one of the things that I know you have been very involved with in Saline, Michigan, is the brain health cafes to kind of help get rid of that stigma. And it goes back to what you were saying too, Dr. Robinson Lane, is that about the socialization and the movement. So talk with us about what we can do as a community to help keep people engaged and involved, and even once they have dementia, to help keep them involved. Jim, do you want to share a little bit with us about what's happening in Saline in that regard?
Sure. As you mentioned, we have begun a couple of years ago a program called a Memory Cafe, and it is a monthly, very informal, social, educational, entertainment event specifically for persons living with dementia and their caregivers, family, and friends. And the idea is that all of these people can come together in one place without any concern about stigma or embarrassment because everybody in that room is on the same journey. And we try to help them make connections, make new friends, have a good time, listen to some music, which is always, always good for people living with dementia. We tell some stories. We do some things like chair yoga or chair exercise along the lines of trying to stay as fit as possible. Our cafe has been growing itself, and it's also spawning several other memory cafes in our area. And we are happy to be seeing that taking off to get more and more people living with dementia and their family and friends uh, together, connecting and socializing. We think it's very valuable.
And
Absolutely. Go
it
ahead.
definitely is valuable. We know from some of the other work that we've done, not just in dementia care communities, but also in long COVID care communities, where we know that people are sort of often voluntold, we say, into caregiving, where you don't really have a choice in the matter, but you end up becoming engaged in this. And it can have the caregiving aspects can be really challenging to adjust to. And one of the things that makes a significant difference from the voices of caregivers has been to have the support of family and friends and having a community and different ways of connecting with people. And so I think that it's really critical to have not only opportunities like, the cafes, but also reaching out and thinking about who is in your circle. Who are the people that care about you, that are there to support you, and reaching out to these individuals to maintain those connections and not feel as though you don't have the capacity to do so, because that's so important not only for the health of the family, but also for the health of the individuals that are a part of that family.
Absolutely. And the caregiver sometimes goes as there's the unsung hero. They're so busy taking care of everyone else. And Jim, you fall into that category. You want to make sure you take care of yourself and the respite care that's needed and the break that's
Mhm.
needed. While at the same time, the person who's going through it, you want them to live their life with dignity and respect and still feel like they have meaning. But sometimes we're so busy pouring into others, we don't pour into ourselves, right? So
And,
how do
and,
you?
and And we also forget to pour into the relationship. And that's one of
Mhm.
the things that makes, I think, that transition to a caregiving role so much more challenging, is because there sometimes can be this conflict between being a caregiver and being a relative, partner, spouse, etc. And so the more that we can find ways to relieve caregiving responsibilities and let other people do some of that stuff, it allows for more space to serve one another as family, and whatever that might look like and how it evolves over the illness journey, whatever that might be, whether it's dementia or another chronic condition that requires us to support people in ways that we haven't had to do so before.
Great. Jim, do you want to respond to that as well? How do you take care of yourself?
Oh, I completely agree that it is um, vastly important for caregivers to take care of themselves. There was a point at which I was taking care of my wife Kathleen all by myself because, like so many caregivers, I figured, hey, she's my wife. It's my job to take care of her, and I got to do it all by myself. And on the way to the hospital, they were taking me to the hospital because I had collapsed, and I kind of figured, maybe I need to make some changes here. Um, and I did bring in some home health aides, and that transition of no longer being the solo caregiver and getting help, be it home health aides or at a memory facility or any combination of that, is so important. You're absolutely right. It's so valuable so that the spouse or the adult child can resume the loving relationship without as much
Right.
stress associated with the 24/7 caregiving with all the ADLs, the activities of daily living that are required. It is so valuable. I am much more comfortable and indeed much more in love with my wife today than ever before, even though she doesn't know who I am, but that's okay. Whoever she thinks I am, she knows I'm somebody who loves her, and that's all that I need.
That's so powerful, and I am so thank you for sharing that personal journey as well. I think people need to hear more of those types of stories and stop being ashamed to talk about, your loved one that is showing some signs of cognitive decline, or some signs of brain health, and to think it's the end of the journey. There's nothing you can do. You can live a meaningful life with dementia. But what are some of the early signs? What do people need to? How do they even know when they need help?
In the beginning, I think one of the things that can be really challenging for family members is oftentimes, and I'll say the vast majority of the time, the person who recognizes that they need some help is the person that is dealing with the dementia. But there's a lot of fear about having a condition that affects cognition. What does that mean about your autonomy, about your how other people will view you, about how you will be continue to be engaged? And so the typical things that we start to see is forgetfulness. And oftentimes it's losing things that are of importance. It might start with small things like losing glasses and keys, things that all of us, have misplaced, and particularly more so as we get a bit older and a bit more distracted. But it's this happening on a more continual basis, and the things that are becoming misplaced are more important. Having more difficulty with when you're driving, getting to where you're going, completing usual tasks that you might complete at home, where it starts to be able to affect your usual daily life. And when it gets to the point where family starts to notice, it usually is pretty significant by that time, because often individuals do a lot of things to kind of mask or cover up the challenges that they're experiencing by doing things like writing lots of notes to themselves, keeping special watches that tell them the information that they might need to know, and even in conversation, either being thoughtful about how they respond to things or responding in general ways where they don't have to fill in the spaces in which they're really uncertain. And so, ideally, in these still fairly early stages, it's important to Usually a neurologist is somebody who can go in, a special type of doctor that can go in and provide an assessment. One of the places in southeastern Michigan where there's lots of specialists is, of course, at the University of Michigan within our Michigan Alzheimer's Disease Center. There's lots of resources both for caregivers as well as for patients, who need support. And there's other um, um, types of spaces where you can also see, neurologists to get an assessment. You can also talk with your primary care doctor about any cognition concerns that you have, and they too are able to do a basic assessment to let you know if there should be a follow up with a specialist.
Thank you. And Jim, what were some of the early signs that you witnessed? And then following that question, because we've got a little bit of time left, but find that question, I'd like to also find out where people, how they get resources and information, where they can go to do that. So Jim, what were some of the early signs that you witnessed?
One of the first things was my wife would ask me how her sister was doing. It was kind of a surprising question because her sister had died 2 years previous.
Mhm.
And in those days, as a newcomer caregiver, I didn't even know I was on the journey. In those days, I didn't know any better than to tell her the truth.
Mhm.
So I told her, sweetheart, your sister died 2 years ago. And of course, I upset her. And then when she asked me the same question 10 minutes later, I did the same thing. Now that was dumb. That was not good caregiving. I have learned much better since then. In fact, I have learned since those days that there are many, many good sources of information. Of course, the University of Michigan, the Michigan Alzheimer's Disease Research Center, is an excellent source. The AARP itself offers some really good information. So does the Alzheimer's Association, for whom I work as a volunteer community educator now. The National Institutes of Health also offers some very good information. And all of these are reliable sources of information. None of them are trying to sell anything. They don't have a commercial agenda. It's all good information. And the point is, there is a lot of good information out there and a lot of good organizations and a lot of good people out there willing and able to reach out and help people. No one, no family, no person should ever feel they have to deal with dementia alone.
Very well stated. I know AARP, Lisa Cooper, Dayton Cooper, who both of you know, is helping to lead the Michigan Dementia Coalition. Just information, please go to our website. It's on the screen here and learn about what resources are available. But dementia is not a death sentence. It's not the end of the road. So, Dr. Sharia, tell us a little bit about what can be done if someone like Jim saw the signs in his wife. Is it just continue to get worse, or is there medication? Is there something to kind of help prolong that? What can be done once you see those early signs appearing, surfacing? What can you do?
Sure. So, although there is not currently a cure per se for Alzheimer's disease, there's a lot of things that you can do to create a safe environment for individuals and to make sure that you have the support that you need. And so, one of the first things that you probably want to do is think about the safety in your home, because as individuals are still able to walk and move around, there may be challenges of like somebody who's used to cooking, starting to cook, and then leaving the stove on. And you have like, for example, smart stoves that will automatically turn off after they've been on for a bit, or that connect to Wi-Fi that are not incredibly more expensive than buying a new stove nowadays. You can put in an alarm system or add the chimes to your already installed alarm system so you can hear when the doors are opening and closing to know if somebody were to leave. You can make use of cameras, like Ring cameras, to keep track if you are a distance caregiver, to kind of keep track of who might be coming and going. So there's a lot of different types of safety things I think that you can put into the home. And then also being thoughtful about long term, and being able to have conversations with your loved one about sort of what the long term plan looks like that they're comfortable with and that you're comfortable with, to plan for it's a general decline in health that takes, a number of years
Mhm.
to happen. And so I think really just sitting and planning and processing things and getting the support that you need through some of the organizations that were mentioned can make a large difference.
Thank you so much for that. We've got about 30 seconds left. But one of the things that you all said that was just so critical, and Jim, I think you talked about this several times, is don't be ashamed to talk with someone, right? Pick the phone up, call a friend. You don't have to hide this. You don't have to cover it under the rug or in the closet. It's a disease. And so we want to make sure that people get the kind of help they need for the disease that they're going through, and that the caregivers receive the type of help and support that they need as well, whether it's a memory center, whether it's a cafe, whether it's the neurologist, or whatever it might be. Speak up, say something, and you'd be surprised how many people are going through something very similar to what you're going through as well. Which is why I appreciate so very much, Dr. Mangi, you're sharing your story with us about your caregiving journey with your wife, and you also, Dr. Robinson Lane, about the phenomenal work that you're doing and have been doing in this field. So thank you to both of you. Appreciate you. And to you, our listening audience, there's information on our website, arp.org/MI. Please visit our website. There's tons of information, free resources, no advertising about where you can go and get some help. Thank you for watching AARP Real Possibilities.
Good afternoon. I'm Dr. Trin. I'm here joined with Dr. June today. We're going to talk about flu vaccines. Which populations of patients do you recommend the flu vaccines for?
Well, that's a good question. Certainly in my clinic, we have a lot of at-risk individuals who have immunosuppression. They're on immunosuppressing medications, or they have inflammatory condition, which robs them of some of their protection that their immunity would have. So certainly all of that population, I'd recommend getting a flu shot if they don't have an allergy to it. But generally speaking, flu can affect just about anyone. So my general recommendation, and this is pretty broad, is that everyone consider getting a flu shot if it's right for them.
Okay. Are there any certain populations that should not get the flu shot?
Well, obviously anyone who's been allergic to them and the products inside, not all flu shots are the same, so they should be aware that they are manufactured differently. But if they're allergic to any of the components of the flu shot, they should not get the flu shot. There's very few people, I would say, that I would recommend against getting the flu shot, because it generally is a well-tolerated, safe, and protective vaccination.
Well, there's flu shots, but then, there's COVID shots out there, Shingrix, the shingles shots. Any recommendations as to how people should space out the vaccinations? Should they all get them on one day?
That comes up quite a bit. So my answer to that is, if you only have one day to get them, yes. But if you can, it's good to space them out a little bit more so you can get a more robust response from each of the vaccinations. Now, the data on it is suggestive that if you get all of them at once, you do get protection. But if you have a reaction to one, or you feel ill from getting after one, you won't know which one it is, which is then would be confusing to some people. But more than that, your immune system might not give a full effort into each one of the vaccines themselves, meaning you don't get the full robust effect that you're looking for getting the vaccine. So if possible, spacing them out at least 2 weeks would be more helpful for them. Once again, that's a soft recommendation, but generally speaking is to space them out, especially the Shingrix vaccination, which is known for, making people feel a little bit down and under the weather after getting it.
Okay, I would agree with that recommendation with the spacing out. Who do you think patients should go to in regards to vaccination recommendations and making sure that they stay up to date on their vaccinations?
Well, their primary care is certainly going to have a discussion with them about that and give them the recommendations. Most vaccinations, though, including the other than the flu shot, is generally required to go through a pharmacy now to get them. But definitely talk to their primary care first or their other specialists before getting any vaccinations.
Thanks, Dr. June.